Okay. We are calling to order the first meeting of the Mental Health and Public Safety Fund Advisory Council, or FAC. First on the agenda is roll call. Stephanie Barish. Present. Susan Schaefer. Here. Donna Bolin.
Here.
Kevin McCarthy.
Here.
Sheriff Matt Lane.
Here.
Cassie Taylor.
Here.
Okay. The next item for agenda is the election of our presiding officer. This is a one-year term and needs to be elected between the members that are present here, not including Cassie or myself. Susan?
I'd like to nominate Donna Bolin.
Do I have a second?
I will second that motion.
Is there any discussion? Okay. Any other nominations? Okay, then we'll move to vote on the item of Donna Bolin being voted as our presiding officer. All in favor?
Aye.
Any opposed? Okay, the motion passes.
Now you can officially turn it over to Donna. So then now Donna will lead the rest of the meeting.
Okay, the next items are just for information.
The next items are just for information. Do we really need to go over each of them? Do you have a PowerPoint?
I do have a PowerPoint, just to make sure that, I know obviously a lot of the people in this room have already been a part of the Behavioral Health Coordinating Council reorganization plan. I just wanted to make sure for the sake of the record and for the sake of all the members present that we get a chance to review it and spend a little bit more time with the FAC specific parts of the ordinance. So just a little bit of history. In March, of course, the Behavioral Health Coordinating Council meetings were paused by Chairman Catherine Metzger. July, there was an ordinance that had changes to the relevant chapter of the county code related to committees, and that was passed. The first kind of reorganization meetings for Behavioral Health Coordinating Council have occurred. We had our first one, I believe it was July 12th, and we had another one in August, which means that it is now time for this group to meet. The main things that the ordinance did as far as changes was it established the Behavioral Health Coordinating Council as an independent forum. It provided some additional needed clarity around powers and membership, both in Behavioral Health Coordinating Council and in the Funding Advisory Council. And of course, it also created this separate Funding Advisory Council. BHCC's new role compared to what it has been is to meet at least quarterly. The BHCC is in charge of reviewing and updating the Mental Health Action Plan, as well as making recommendations from that Mental Health Action Plan to the Funding Advisory Council. We also anticipate that, as before, they will continue to facilitate conversations about aspects of the community's behavioral health system amongst its stakeholders and continue to recommend policies to both public and private agencies for the improvement of that behavioral health care system. To clarify, this means that the BHCC will not be reviewing specific funding requests, as has happened in the past occasionally. There will not be anything that the BHCC has to do with approving individual or departmental staffing, as well as approving agency or departmental budgets, and they will not be managing or directing any agency or department's work. BHCC membership was additionally clarified into 3 separate categories. So there are agencies, there are folks that are intergovernmental folks, so folks that are more connected to the intergovernmental agreement that created the funding, the Mental Health and Public Safety Fund. And then there are also some non-voting members as well. Membership responsibilities for Behavioral Health Coordinating Council include being familiar, involved, and invested in the Mental Health Action Plan, making sure that there's some sort of organizational presence at meetings, advising and leading initiatives addressing priority areas within that mental health action plan, and participating in focused planning. The intergovernmental members include someone from the Normal Town Council, someone from Bloomington City Council, someone from the County Board, as well as someone from the 11th Judicial Circuit and the Regional Office of Education. There is a list of behavioral health coordinating council agency members here, including Carle Health, OSF St. Joseph, Illinois State University, Chestnut Health Systems, someone from the McLean County Jails Inmate Services, the Baby Fold, PATH, Home Sweet Home, Lifelong Access, Project Oz, someone from the National Alliance of Mental Illness, NAMI, their Mid-Central Illinois chapter, the Center for Human Services, and the Center for Youth and Family Solutions. I mentioned that there are some non-voting members in BHCC as well, called ex officio because of the nature of their role, and that includes myself, the Director of Behavioral Health Coordination, the County Administrator, and then the Director of the Public Health Department here in McLean County. As Director of the Behavioral Health Coordinating Department of the county, I am also considered the clerk for the Behavioral Health Coordinating Council, which more or less means that I am providing staff support, administrative support, operational and strategic support, preparing the meeting agendas, distributing materials, and then preparing meeting notices and keeping a record. Generally speaking, what this has changed as far as the flow of information is BHCC is the group that is creating the mental health action plan, which then feeds into what the Funding Advisory Council determines are going to be those funding priorities. And that is a combination of all of that will go, the recommendations made by this group will move forward to the county board budget process. As far as the membership that is listed in the ordinance for the Funding Advisory Council, that includes the members from Behavioral Health Coordinating Council from the Town of Normal, the City of Bloomington, and the County Board. And then Behavioral Health Council, the Behavioral Health Coordinating Council is responsible for electing a representative from their group. And then the Criminal Justice Coordinating Council is also responsible for electing a member from their group as well. The ex officio non-voting folks are also considered the county administrative support for this group as well. So as is my role for the Behavioral Health Coordinating Council, I will also be providing administrative support to this group in helping to gather meetings together, materials, those kinds of things. So your role, according to what is written in the ordinance, is providing recommendations to the county board for budgeting and the allocation of funds through the county's Special Mental Health and Public Safety Fund. So the two parts of that fund that are relevant to this group would be criminal justice services related to detention facility operations for behavioral health services, and then community behavioral health initiatives, services, and programs that are, of course, consistent with the Mental Health Action Plan, which the Behavioral Health Coordinating Council is also, of course, keeping in mind. The ordinance requires that we meet at least annually, and that meetings are held in accordance with the Illinois Open Meetings Act. There is a proposed sort of workflow for how the spending process sort of will work. We start, of course, with the Mental Health Action Plan. The Behavioral Health Coordinating Council will create annual strategic priorities from that action plan, and then this group will create those funding recommendations based on those priorities. It will be then my job as the clerk to submit that budget to the county board with those recommendations from this group. What that would look like going forward is the county board would approve the budget through the normal budget process that we normally see. And then it would follow standard county rules as far as contracts and procurement goes. So if there are expenditures that are less than $30,000, that does not require a formal request for proposal process, but still goes through a financial process to ensure that it's an appropriate contract based on best practice recommendations from the BHCC, and that it's fair and competitive if there are multiple places in the area that can provide that service. Anything greater than $30,000 is something that requires a request for proposal process. So that is something that I, as the Director of Behavioral Health Coordination as a department, would prepare an RFP as directed by this group. And then we would most likely create a group of subject matter experts with considerations to make sure that there's no conflicts of interest, so that those proposals can be reviewed by people who are going to understand the needs of the community and what those best practices are. And then the highest rated proposal would be sent to County Board for approval. And then depending on what that contract looked like, chances are decent that either I would act as contract monitor or we would leverage staff from the Behavioral Health Coordination Department in the county to provide additional administrative support for those efforts. What has come about since all of that has happened is the Behavioral Health Coordinating Council has taken the Mental Health Action Plan and narrowed down some strategic priorities that they are recommending that we focus on now through 2025. I have passed out more detailed information about those, but generally speaking, those priorities are to increase public awareness and education about services, to increase accessibility for specific vulnerable populations, to increase safe shelter space that has behavioral health service integration included, to innovate human service recruitment and development efforts, and to create a group to explore interagency data collection standards. Most of the folks at this table were actively a part of that process, but I did want to make sure that everyone is on the same page as far as kind of where our first priorities are. And I believe that is it. Is there any discussion about the information that's been passed out?
Thank you. Making sure I'm following all the bullets in the process. Thank you for the history, by the way. Appreciate it. So I'm assuming you showed us the less than 30,000 process. I'm assuming the over one comes back and we're part of a review process? No.
I don't believe so, no.
So is it the same process for over 30 that is for under 30, or what's the difference? Is there a difference?
Chair, may I have the floor to answer those questions?
I apologize, Chair.
Repeat the question.
Sure.
I didn't hear it because you were
Sorry,
talking that way.
I apologize.
That's all right.
So we saw a process for requests for proposals under $30,000, and I was just curious how the process differed for proposals or services that we're seeking that would be over $30,000. What that process, the different process would look like, if any.
That would be a question for Cassie, but yeah, I'll pass it over to Cassie because there should be a difference. There should be a difference. The city has a difference between, over X amount, it has to be processed different than, yeah, so.
Absolutely. So the county will follow the standard county purchasing and contracting procurement rules. There are different standards if it's over $30,000. However, this group will not be reviewing any invoice that's over 30,000. So that was the distinction I wanted to make to Mr. McCarthy, is it would not have to come back to the FAC group. We would just follow standard county policy.
Follow up. Go ahead.
Go ahead.
So follow up, I'm assuming basically same process. There's a review committee that helps evaluate proposals, whether they're below or above 30,000, or is it a different process altogether? I'm trying to understand the difference in the process.
Yes, depending on if it was a specific grant that was coming through. Yes, there would, if it was over that amount, we would get together a group of people to kind of help create what that proposal is going to look like. And then the dollar amount really just determines if it's got to have to be that formal RFP with all the rules that would come with that, if that helps to, is there any other information?
I would also just acknowledge that if this were grant dollars that we were sending out for a community project based on our 5 strategic priorities that we've identified, that that process would have a review committee. And it would be made up of subject matter experts that may or may not be people in this room.
So a formalized review structure and body for over. Gotcha. Thank you.
Okay. So the next is, any other items to discuss? I would like to make a comment. We are about to approve the bylaws, and I'm a wordsmither, so I did just a few wordsmithing, and I had Marita pass it out, and it's marked in red. And of course, the bylaws that we haven't passed yet say 7 days in advance before passing, but I wanted to get them in your hands so that you can review them, and if you want to change them, that's fine. I just throw that out there, so. Yes, Susan?
I'd like to make a motion that we approve the bylaws that we were distributed, and then we can, kind of like what we did at BHCC, go back and make updates.
Oh, yes, I'm not proposing that we, add any amendments today. I'm proposing that we, approve the bylaws that were sent out from Marita, but then at the next meeting, if we decide that whatever amendments anyone at this table wants to make can be voted on at the next meeting, provided they're given to us 7 days in advance for our review.
Right, so I make a motion, and I'll say something after that gets a second, so we make sure
Okay.
we do the correct order of things here.
I was just going to ask procedural. I'm assuming I'll second that we have to motion and second before we start the
right.
discussion. So second.
Okay, and to me, it's the same as at BHCC, is that in order for us to actually function, we need to have these.
Sure.
So that's why I'm saying that let's go ahead and pass these as they were distributed, because then we have something.
Sure.
And then, like you mentioned, we can go back and look at anything that anybody wants to edit, change, add, whatever, because there were quite a few things that were added to the BHCC bylaws that, that will be given to us at our next meeting. So, yeah, that's
I
kinda how my-
agree.
that's kind of how I'm looking at it.
Yes, Kevin?
Reading through these, thanks for these. Really, the only question I had is similar to the BHCC bylaws is, as a group, do we want to enable virtual attendance, particularly with such a small group? Sometimes if, a quorum might be a problem if we don't enable that. So I'll just open it up. If anybody else has any thoughts or opinions about that, I'll let everybody discuss.
Susan? Or,
Yeah, I do have an opinion. I think on this small group, and I think because of the topic matter that we're discussing, I think that it's kind of important to be in person. Because it's, that's just my opinion on that it's the topic matter. I mean, it's just like, a budget meeting. If you're going to go to a budget meeting, it's kind of better if, in town or the city or whatever, that you're there just because of the subject matter compared to BHCC, where it's a little bit different subject matter.
And that's fine. I don't have a hard horse in this conversation other than if so, because of and I agree, mostly if we do take that approach and decide not to enable virtual attendance, then I would urge us to do as you did. Doodle these things. If we're not going to set up standardized meeting schedules, then putting it out to make sure that we have quorums attending, we have the majority of representation here in the room, so we can conduct a meeting and do that. So however that works best, I'm not, I don't, other than let's make sure that everybody's here and has the opportunity to vote and all that, whether that's doodle polling or enable virtual attendance. I'm fine either way.
Okay. So there's a motion and a second. So do we take a vote? Roll call, or maybe on the action items like this, should we do a roll call? Thoughts? Okay. Roll call? Okay. Susan?
So for the vote of adoption of the FAC bylaws draft as passed out within the attachment, Stephanie Barish,
Agreed.
Susan Schaefer,
Yes?
Donna Bolin,
Yes.
Kevin McCarthy,
Aye.
Matt Lane.
Yes.
The vote passes.
Okay. The next item is recommended budget for community behavioral health initiatives. So it's the BHCC. I'm going to make a motion.
I'll make that motion.
Okay.
Second.
Okay. Motion by Susan, second by Kevin. Any questions or comments? Yeah, Kevin.
I'm going to be that guy.
I'll be next.
You'll be next. All right. This,
Can I like a point of order?
Sure.
Did we want to have Cassie maybe explain this process to us?
Well,
And how we have these numbers in front of us and stuff like that?
that would be helpful because some, like, whatever it is, SOS and all the ABCs, and, that needs some explanation.
Great.
So, yeah.
So, thank you for the floor. To start out, this was the first year that we've had the FAC, so it's adding another step within the county's budget process. And so I very much appreciate the timeliness that this group is meeting so that we can continue on with our cycle as I have to present a proposed budget to the full board in September. So just to give you some background, our department heads are asked to come to meet with administration to review their proposed budgets. They enter those into our software system, and that starts in June. And so during the months of July and maybe the first couple of weeks of August, we meet with each of those departments to review the budget, make sure we understand the requests and they fit in with the mission of that department. And so those meetings have taken place. For the community behavioral health initiatives, that meeting took place with Marita and her staff. And for the criminal justice coordinating council, those are the criminal justice related services. Those took place with all the criminal justice partners that attend the CJCC. So that step has been completed. So next up is meeting with you to make sure that what we have proposed and moving forward through the Special Mental Health and Public Safety Fund is congruent. So with the community behavioral health initiatives, the total program costs that we have proposed for at the beginning of this meeting is $4,173,773. That would include the salary and fringe of our existing county staff that complete the efforts of the BHCC, the FUSE program, any other behavioral health initiatives that are directed by BHCC or the county. It also includes operating supplies and expenses, contractual service lines, our existing programs, which includes things like our record system for Fuse, our community events with the Behavioral Health Forum, those contracts, our contract for data collection with the Stevenson Center with Dr. Frank Beck. And then we also have a contract that would be going into its third year, and that is for our behavioral health urgent care through the Center for Human Services. We've budgeted money for those services. And then in anticipating grant contracts through granted dollars, through the priorities that were established through the BHCC, we anticipated 1.5 million to go to those efforts for the next calendar fiscal year. I want to make a specific note that this dollar amount happened in June before some of the recent conversations that have taken place about other ideas or proposals that you may have heard about. So this was a very preliminary number that we put in. And that is our proposed budget for community behavioral health initiatives. To follow up with that, the fund collects about 4.8 million a year in total for the 4 separate buckets that we have been setting aside funds for. So if we were trying to look at revenues coming in each year, they're about 1.2, just a little over 1.2 million for this fund coming in. And so you can see that this budget is expending quite a few reserve dollars that we've had allocated for community behavioral health.
So the total program cost at the top says 4 million, but if you add those numbers up, you only get 3.5 million? Because I just did that.
The right copy? Okay. So we did have some updates to this.
There was an updated sheet that I sent out that was not included in the attachment packet. So if you only printed out the attachment packet and not the additional form that was sent out, then the numbers that you have might look different.
I thought the first one had the 3, and then the second one had the 4.
I am confirming the numbers right now.
I am looking at the new one that was sent out, and the numbers match this printed copy.
Okay. So the changes that were made, the updates that were made, there were 2 areas where we made changes, and I'm not sure why this is not adding up. The 4.173 million is the correct total amount. What we changed from your initial spreadsheet were to add the matching funds that are necessary for our Systems of Care grant, which were about $207,000. And then we also added, was it about 20,000 in administrative costs? So that was added as well. So the county costs for providing payroll, administrative support, legal support for these efforts.
Oh, yeah, go ahead. Taking
I
notes,
think,
sorry.
I think I followed that, but the difference between your 4.173 and what it adds up to is the 608,510, which is the Systems of Care grant. Is that what you said?
Yes, well, I think we have a typo somewhere, but the grant should have been added into the program expenses for community behavioral health initiatives, but it's only the matching funds that would come out of fund balance, so 207,179,
Is what should have been included,
correct?
but 608,510 is what got included, it looks like, from in the 4.17 number.
Okay.
Am I making sense?
Yes.
Because the
so-
difference between what it adds up to and the 4.173 is exactly that 608,510.
Okay, so I'm going to do some quick math and fix that.
Okay. Former accountants.
Stephanie, yes.
Wouldn't the entire cost of system of care be included in expenses while the revenue from SAMHSA would come in as revenue?
Yes. But we still have an administrative surcharge that's not included, so I think there's another adding error that I need to correct. Very good. So. So if you look at your operating supplies and expense lines, on the original document, it said $15,930. And on the correct total, it should say $36,439. So that's the additional administrative surcharge. So that number is correct. Salary and fringe should say 777,327. Contractual services should say 110,318. Existing programs would be 291,179. And then for to the existing contracts for services, we would want to add the $207,179 to that line. So that would be yeah, 1,057,179, which $3,772,442. I think that's right. That would be the total program cost, not including federal dollars that we would be reimbursed for. $3,772,442. Correct. So because of that error, you might see that same error on the subsequent summary page.
I guess I have a procedural question. If we're going to be approving this, I would feel more comfortable actually seeing the corrections before, seeing the corrections printed out before voting.
So that could make this meeting a very quick meeting. And we could table this vote on the budgets until another meeting time. That's certainly allowed.
Well, I have an additional question. First of all, to explain what those, alphabet soup is. But then also, people ask questions from us, and I know what the existing programs are, but people will have actually asked me, how much are you paying for Fuse? Which means ROI. You're serving 9 people, but you're spending this amount of money. So people get that detailed. I want to be able to have that information. I don't know if you want to put it on here, but, itemized. Is that too demanding? Yeah, Susan?
In our county budget process, because this is a county budget process, we, as county board members and our oversight committees and stuff, don't get that kind of information.
Okay.
We don't look at each one of the programs that the sheriff's department has, or court services, or the parks, or anything like that. We don't look at individual type programs
Okay.
to adjust their budget based on whatever we hear, or, that kind of thing, or what we believe. So I think that maybe it's kind of like almost micromanaging in a way, some of that kind of thing, to get to that, because I think that we just have to understand what we're doing and what the process is and how that works. So,
So
does that help you a little bit on that?
Yeah, so basically, all that information would end up being reported in here, rather than during the budget approval process, correct? As far as, ROI, because in here it does say, X amount of clients are served and this type of thing. So is that, I'm just trying to understand, because the county does do things differently than the city and the town, so.
Sure. So I paused when the question was asked because I was thinking about the request, and it sounded more like a program evaluation. And
Okay.
what you call return on investment for these funds is really evaluating the effectiveness of a program and how
Right.
many people are served. And so that is reported in different reports that are received by the county board that Marita provides to the executive committee, as well as in your annual report that the city and the town receive. And I think that might be a more appropriate place for that level of detail. Certainly, we could speak to what existing programs are being provided for and what existing contracts for services
Okay.
are included when we come up with these totals. However, that level of detail is not usually included in a budget review.
I mean, I understand, I'm not sure it needs to be done, but when somebody looks you in the eye and say, you're only serving 9 people, how much are you spending on this? First of all, they don't understand, but those are the kind of questions they get. So I don't necessarily want detail, but, okay, human services, we're paying them through contract. It would be nice to know how much that contract is for. That's all I'm saying.
Okay.
So
So
it's not necessary if that's not part of your process at the county level?
that level of detail is not part of the process, no.
Okay.
However, Marita could probably speak to some of the existing programs and existing contracts.
I also want to say too is that at the county, yeah, Kevin wants to talk. That how much the contract is for urgent care. That goes to oversight because it's over that $30,000. It had to go out for,
Okay.
that kind of an RFP. It went out for an RFP. So
Confused.
yeah. So those contracts do come to us.
Okay.
For those kinds of things. So there's that part of it too. Yeah, like I said, it's a county budget process, which I don't understand the city or the town's budget process on how they work. So it's okay.
Okay. Kevin?
Thank you. Good discussion, I think, as we're all coming from different perspectives of spend and review. I'll use that label here. So kind of back to why are we here? What's our point and purpose? And so this is a bit of a unique animal. This is the first and probably only time we'll do it in this manner, and then it'll change a little bit as we go forward. So our charge is to essentially make sure that we're making funding recommendations that line up with mental health action plan and then the other IGA things. I mean, we've spent a lot of time talking about in alignment with mental health action plan, but it's also in line with the IGA, which is CJCC spending, the jail spending for, obviously, we're paying debt at this point, check, built, pay it. So not a lot of discussion there. Staffing, we're not going to have a lot to say. That's going to come recommended to us by the folks doing that work. And we're going to say yes based on whatever that is. So as we look at this, and some of these are easy, right? Funding the debt, fine. These are easy. I think the harder things for us to try to decide is when we look at this first page, and I have to answer the question, does this line up with the mental health action plan? If I don't have some idea of what 1.5 is, how do I know that that's going to line up? Now, I know there's a more process coming, which says look at stuff and say yes or no to. But as we overarchingly look at this, which I think is a little bit, maybe I'm wrong, Donna, you can correct me if I am, gets at what Donna is looking at is, so this is a certain level of detail about staffing and all the like. When I look at the whole spend, is this achieving the strategic priority, yes or no? And so some detail of that $1,500, wouldn't that be great? 1.5 million bucket when we are approving a budget. There's that when we're approving, saying, okay, 1.5 million, we don't know what it's for yet. We'll have a second pass opportunity to review that when it comes, sort of.
So I appreciate you pointing out that this being the inaugural meeting, the process will probably be different in the future. I hope so. So
We're feeling our way through this.
yeah, so the grants, really, the focus of this FAC group is really to just decide how much money do you want to allocate to community grants. So when we had our strategic priorities meeting with the BHCC, several times the question came up, but how do you put that into an RFP? How do you put that into an actionable change for the community? And so that is why you hired a director of behavioral health coordination. So Marita will be working with the BHCC group and other community partners to say, all right, we have our priorities. We know that they were the 5 items that we just looked at on the presentation. How do I divide that up, and what can we tackle first? And so the focus of this group would not be to divide up and to allocate a certain dollar amount to every type of priority or every type of project. It would be to say, we have this many dollars in reserve. We want to allocate this much to community efforts in the next calendar year, January to December.
Okay. Oh, Kevin, one more
I've
question.
got more. Are we, I know we're running short on time here. So are we moving forward with the budget decision? Is that, you questioned that, so I'm
I did,
question back to you.
Matt.
I guess my question is, if we do not vote on this budget today, what's it holding up?
If we,
Can we still get in process for your budget process?
So I would need to convene, we would need to convene another FAC within a week.
okay, Susan?
Microphone. Because it was green. One of the things too and I don't know how the city and town does this, but one of the things that we can do is that we can approve this budget. And if BHCC comes back and says we have another priority that we want to address in this next year, or we find something that we want to maybe do more on, we can always come back together and do a budget amendment to do that. And so, I mean, granted, we only have to meet once a year to actually just get this process done. But if there's something else that occurs, I said if BHCC all of a sudden comes back and says, hey, we really need FACT to meet because there's this new priority, I won't give examples because there's some things that, pretty traumatic types things that could happen in the community, that.
Well,
that-
I'm not talking about BHCC bringing
But-
back
but-
another item, though.
But that is what we can do. We can approve this budget so Cassie can move forward with creating the county budget. And then if we want, we can come back together and say, maybe we want to do more. Maybe we want to, that kind of thing. And then you would do a budget amendment to the county board.
Well, we're not going to give enough time for the CJCC. What I feel uncomfortable with is that you guys are doing, jotting down all these different numbers on the sheet, and, I mean, I don't see them. But if everyone agrees that they're comfortable approving a budget that has notes on it, then we will take a vote rather than table and have to come back.
I would just say that my numbers matched their numbers, so I feel confident with the number.
I'd be happy to review to explain the one line that had a change,
Okay,
which then changed the grand total.
okay. So do we have a motion or not yet?
You have a motion by Schaefer.
Okay,
Second by
okay.
McCarthy.
then let's take a vote.
Did you want to?
Would you like me to review one last time so we're all on the same page of the numbers?
I'd be happy if
Okay.
that's okay with the chairman.
Start with page 1.
Yes, so we're only voting, the only action item that we're voting on right now is the Community Behavioral Health Initiative, so that's the first page of your packet. The total program costs would be $3,772,442. The salary and fringe is $777,327 as written. The operating supplies and expenses are $36,439 as written. Contractual services is $110,318 as written. Existing programs, $291,179 as written. Existing contracts for services, this is where the edit or amendment was made. The total is $1,057,179, which includes the matching costs for our Systems of Care grant, which is SOC.
Okay.
And then lastly, the anticipated contracts for grants to community partners is 1.5 million as written.
I trust Stephanie, too. So let's go ahead and vote.
Hey, can I ask?
Oh, yes, Kevin.
So I'm going to be skipping ahead a little bit, and I appreciate all of these pages. Perhaps a question for support. The last page, the summary page. You mentioned that we're spending now 3.772442, which is above the 1.2 revenue. So we're spending down on obligated. I heard that. So two questions. One is that this year, or do we anticipate future doing the same? That's part one. Go ahead. I'll pause.
So to answer your question, yes, we are spending down unobligated reserves. And in meeting with staff next year, we will be trying to create a budget that can be sustained within the existing annual budget.
That's where I was going, because if we're pushing 800,000 in salary and fringe, and we're taking 1.2, it's a net of 400-ish. I'm assuming that's part of the addressing. Okay. And then the summary page question, 6.358 million in unobligated. Obviously, we're trying to spend some of that down, of which 1.5 million for community grants would be part of that?
Yes.
Okay.
So these numbers are as of July of this year.
Okay. So I'm supportive of this budget and moving it forward today, so we can keep it in process. As we move forward, right, I like the notion of the anticipated budgeting of community contracts. Can I call it that? 1.5 million. But looking at this budget and this level of spend, we wouldn't be able to do that on an annual basis if our budget is as we're looking at it now. So that's my only comment as we move forward.
Okay.
Thanks, Chairman.
Roll call vote?
Stephanie Barish,
Yes.
Susan Schaefer,
Yes.
Donna Bolin,
Yes.
Kevin McCarthy,
Yes.
Matt Lane.
Yes.
The motion passes.
And now we move on to CJCC. Matt?
With the permission of the chair, I will assist the sheriff in reviewing this, as some of this comes from other departments that support
Okay.
the sheriff's department.
Okay.
And since he is speaking on behalf of CJCC, and this too is a new position for CJCC to have a FAC member, I'm going to assist.
Okay.
Thank you.
So for criminal justice services related to detention and behavioral health, we have a total program cost of $1,690,321. Again, this focus area for the IGA has a little over 1.2 million coming in each year. So this is using some of the reserves that have accumulated in this fund as well. So for salary and fringe, it covers the staff that are needed in the jail, including mental health staff for special pods. That's $875,416. For operating supplies and expenses, that includes medication assistance, mental health education and counseling for our residents, emergency housing and transportation post-release for stabilization. Those would be clientele that are pending time in the jail or have been just released from the jail. And then mental health training for staff as well. That's $360,905. We do have an existing program for a total of $48,000, and that is a contract with our community partner, Stevenson Center, with Dr. Frank Beck to do data collection. That's an ongoing partnership that's been in place for many years. And then we have existing contracts for services, $306,000. That is for mental health nurses and jail psychiatrists. And then anticipated contracts to community partners. This would be similar to the grants that we just approved on the other fund in the amount of $100,000. I hope my math adds up on this one.
Does.
Great. Quite embarrassing at the last. So this is, this budget was derived through collaboration with all of the CJCC executive team, including all of the criminal justice offices that make up the work of caring for that population. And I don't think we have a motion.
Matt, would you like to add anything to
I
it?
can answer any specific.
Okay, motion. Matt's got a
So
motion.
moved.
Second.
Second.
Okay, moved by Kevin, second by Stephanie. Go ahead.
I can answer any specifics about the programs in the jail, the staffing needed in the jail, if anybody has any questions.
Okay.
Right now, I believe we've got about 20 hours of telepsych a week. That could always be added to. Probably one of the biggest responsibilities in the jail right now is mental health care. And it's the biggest challenge that I have as a sheriff for the most part. So if there's any questions about where this money is going or why we need the staff, I'd be happy to answer those questions.
I have a question. I'm wondering why the anticipated grants are only 100,000.
I'm not sure which all grants are included in that. I know we have the ILM-MAR grant and a few others, but I'm not sure what all is in that number.
This was identified as we expand our public outreach of CJCC and the efforts of this group. There are opportunities for us to partner with community organizations that serve those same populations. We haven't identified specifically what that grant would look like, but we are thinking for reentry services specifically.
Okay. Yes, Susan?
So I had presented information at CJCC on some ideas from Orange County that I brought back, and didn't know if any of those things were included as to increasing any programming or anything like this, or it's just the current state of affairs, or is this an increase in things? Because I don't know where we were at that time.
Do you have a specific idea that you brought from NACO that you're thinking of?
Well, I think that there was, I just heard what you said about the reentry, because that was part of one of the ideas. But more programming actually inside the jail and more case management, and things like that. And so that would entail possibly adding another case manager, and so it would increase your FTEs. And I didn't know if that was included in things like that or not, or we're just gonna maybe come back and look at that later.
I think that's part of that added person, is to add programs. And we're working on, so there's a wish list from the jail in the inmate services division that they and I need to go over still. But I think that added person is part of added programs that we're anticipating. So does that answer your question? I don't know specifically which ones yet because we're looking through that list.
Okay, but nothing on that wish list then is included on this?
Yes, it is.
Oh, it is?
Some of
Okay,
it
that's,
is.
oh,
Some of
okay,
it is,
that's,
yes.
that, I just want to make sure there's clarification there on that.
Yes. I would also further let this group know that inmate specialists were increased, but also we have through the opioid fund, which is a separate fund that we won't be voting on today, that fund is also going to be supporting a substance abuse person in the jail to address those dual diagnosis needs of people who are incarcerated.
Okay, Kevin?
Thank you. Sheriff, I'm assuming, you mentioned Telepsych specifically, I'm assuming that's in the existing contract for services line?
Yes.
Gotcha, I assumed. Same general question about this budget. I don't have any comments about the breakout, and I'm supportive of the budget. Same general question on the summary page, 1.234 comes into this, but the cost is 1.7 almost. How does that work?
Well, it's a balance of the directives of the board and of the community partners who have noted that there is a reserve in certain funds and asked us to make a more robust effort into finding needs. And so we have found some needs.
Thus a
but-
wish list. Got it.
But we also, and I haven't mentioned this before, and I'd like to put this on the record, that anytime we have grants that are available through the state or the federal government, we go for those and try to bring those to our community. And so sometimes this fund would be a last resort if we had an idea, or as the sheriff would say, a wish list that we could not find an outside grant for. We might use funds for those services in our community. But we do our best to try to find outside sources and use those first, similar to only using matching funds for this fund for our Systems of Care grant. We're bringing in almost $750,000 each year with that grant from the feds. So we would be working diligently to get this back down to a 1.234 annual budget.
Gotcha. I think former Chairman McIntyre said funds of last resort. I think he coined that term. Thank you. That's it for me.
Well, I have one more comment to make, and that's if looking at this, your little bucket has a whole lot of stuff, and the original reason that the taxes were raised were for the jail and the mental health population in the jail. So this is a comment. Go down that list and pull a whole bunch of stuff out. I know staffing ends up being the biggest issue for programs, but I just want to reiterate, the original reason of raising the taxes was for providing the services for mentally ill in the jail.
And thank you for noting that. I appreciate that. And we do have more programs that we can always look into. We have looked in, we do have some grants that help us out with these things. We have a very dedicated, talented staff that have a lot of very good ideas. But again, most of our cost is staff cost. And so I appreciate you pointing that out, because that was my understanding. There's a whole lot of buckets here when there was originally one or two buckets. So yeah, we would or three. But I'm supportive of. I think we need to recognize too that once folks get out of our facility, they need continued care too. So I understand that. If they get that continued care, they don't, there's no less
Sure.
recidivism, and I'm all about it. So that's what that was one of our main goals, is to make sure we reduce that recidivism. We get them the help they need on the inside and the outside so that they're not back. That's our hope. Honestly, if the state, if Department of Human Services could take the people that have been committed to them, it would be a great help, because those folks stay for 6 or 8 months sometimes waiting on a bed. And that really diminishes how much attention we can pay to everyone that needs the attention. So, but yes, thank you for that.
Okay. Oh, Stephanie, yes.
I would just want to highlight, though, that even on the community side, one of the populations that we have clearly identified as being in need is justice involved, or diversion from justice involved. And so even though there may be dollars more directed towards community types of services, much of it still is with the goal of reducing the burden on the jail and the justice system altogether, both pre-connection to justice, but also reentry.
Any other questions, comments? Are we done? No. I know. Okay, so we have a motion and a second, and we take a roll call vote.
Stephanie Barish,
Yes.
Susan Schaefer, Donna Bolin,
Yes?
Kevin McCarthy,
Yes.
Matt Lane.
Yes.
Okay. Any other questions, comments? Yes, Cassie?
So it's not to vote on, but I did include in your packet the total cost that will be moving forward to the county board for the debt service and the integrated justice system project. As Mr. McCarthy identified, those are static numbers that are already in contract or have already been in agreement, but I did want to include those because that is the third bucket.
Anything else? Can I have a motion to adjourn? Oh,
May I just ask a
Go ahead,
question for my
Stephanie.
own understanding? If funds are not spent out of the fund, for example, we've budgeted 1.5, but if perhaps 1.2 of that is what's spent, the remaining 300, does that remain in a fund specifically for these purposes?
Yes. It's a special fund that is not commingled with any other county funds.
okay. Kevin?
Question on the Systems of Care grant, just for my information. I'm not used to seeing a line item description of revenue and that being called a cost summarized at the top. Total program cost of $815, or $689 is made up of a fund balance and a revenue line. Can you help me to understand that, reconcile that, just for my knowledge, to help me understand?
So you're speaking to the Systems of Care grant revenue, 608,510, and then the SST fund balance, 207,179?
Yes, and then specifically at the top of the page, it says total program cost. I'm assuming that 815, 689 is the same.
Yes. So the total program cost includes the federal revenues that will be coming in, as well as the matching funds that are required to run the program. So the 608,510 is what is coming in from SAMHSA, and the fund balance from the shared sales tax is the 207,179. That is the matching dollars that are coming out of this fund to help support that, so that the burden doesn't fall on our community partners in coming up with that match.
The match ratio between the federal match for years 1 through 3 is that we have to provide $1 for every $3 that the federal government provides. And then the last year, it is a match, a one-to-one match.
So if I'm understanding this correctly, feel free to jump in and redirect me because I'm still not sure I got it. But so system of care program expenses basically are going to match the revenue that we've been able to generate.
Correct.
Is that, okay.
Yep.
That helps me. And so, again, the systems of care program,
Initiative
What
is
is it?
probably a better, yeah. Oh, the system of care, I can actually answer that. The system of care initiative is a federal program that SAMHSA started for, as a part of their children's mental health initiative, a kind of, I guess, initiative. It is meant to be a philosophy of care as opposed to like a program where the idea is that no one service, no one provider is the silver bullet in solving our problems, and the what's most important for our communities and our families is that public and private entities work together to connect together, and if they don't provide a specific service that a family or an individual needs, that process to connect that person to that services is very, very easy, and that the burden is on the service providers as much as possible to help people navigate through those systems. It's a national program. I think a version of it started sometime in the 80s. So it has a lot of federal support as far as like training and best practices and those kinds of things. So it was something that definitely matched and aligned with the goals generally of Behavioral Health Coordinating Council. So it's something that we're really excited to grow because we already have a lot of good partnerships and collaboration that already happen in this area. So having the extra federal money to help support those wish lists is something that I think will be really neat to see in the next couple of years.
Is that part of the
Thank you.
systemic change?
Arguably, yes. I think that's a big part of why it connects so much is because it's not about this one program needs to add this one thing. It's about changing how a community works together.
Right. How the system works. Yeah. Okay,
I move we
Stephanie.
adjourn. Oh, sorry.
I was just going to add to that the system of care is the concept of the entire range of services available from one end to the other. And our proposal that was accepted actually is multiple providers with different kinds of programs that are all included under that one umbrella.
Okay. Any other questions, comments, new business? Kevin? No?
Well, it has on here, other business next meeting date with a blank. Are we going to meet again, or is there an intention for us to meet again, or not to meet again for another year?
That is to be decided here. If we do obviously have a lot of time to notify the public if we're not going to meet in another year. But we could set a pattern now and we could elect to,
Because if we want to update our bylaws, then we would have to meet
Yes.
again.
Oh,
That's
yeah.
why,
That is true.
we kind of mentioned that, so.
Yep.
Okay. Marita, can you send out a doodle? And in this blank, put down to be determined.
Yep. How quickly then do we want to plan to meet?
What's that?
How soon?
7 days.
No,
At least.
hard
Well,
no.
put out the doodle, but the wordsmithing, the changes, it has to be at least 7 days,
Yeah.
so,
Sometime in
you know,
September,
whatever.
October.
I don't,
We'll shoot for at least a month. Is just what I'm hearing.
Susan?
Yeah.
Can I make a suggestion? Yeah, about a month from now?
Yeah.
Because that way we get past all of our budget, we get past all of our committees and stuff like that, so that, make sure that Ms. Taylor is a lot more calm, or more, less stressed, I should say, about getting things done.
Yes, that is what we'll plan. I can do that.
should we still just be to be determined? Okay. Is there a motion to adjourn?
So moved.
Okay, moved by Kevin. Second?
I'll second.
Second by Stephanie. All in favor, say aye. Aye.